Hi, everyone. In this session, we're going to talk about Chinese medicine dermatology diagnosis. Remember, my talk is mainly for students and the new graduates, because what I found is when they see the skin condition, they all of a sudden don't know what to do. If the patient come in to tell you, say, I got eczema, and then show you the skin lesion, and then the student normally don't know what to do, kind of lost. Actually, at this stage, you shouldn't panic. You just follow the Chinese medicine diagnose method. There's 4 methods you have all learned. I'm not going to repeat it here. You use 4 diagnose methods. Eventually, you diagnose whether it's 脏腑、气血 disharmony, or some problems, or the 6 pathogen related issues. As I said before, because Chinese medicine was developed more than 2,500 years ago, so by then they don't look at the follicles, they don't look at the pus in the hair follicle or the blockage and all of that. They relate to the skin, to 脏腑 organs, qi and blood, or 6 pathogens, and then they relate skin condition to all of this. We'll quickly go through that pathogenesis very quickly, but we learned pathogenesis in our Chinese medicine theory part. In Chinese medicine, the pathogenesis is commonly very much the same. But when we do the treatment, we do the correct diagnosis, and then we do the treatment, the result will surprise you. It's really effective, especially for skin problems. I found Chinese medicine can bring amazing results. One important thing is you need to tell the patient, just be patient. It takes time. Patient only very oftenly want to have 1 week herbs, 2 weeks herbs, or fix problem. You have to tell them it maybe take 2 months. So now I have read many books and summarized skin conditions in my inspection part, which I found very, very useful for myself when I was a new graduate. Help myself to identify the issue, the reason, or the etiology, and then apply my herbal knowledge to my treatment according to this diagnosis, and then to achieve good result. So now let's start. For the Chinese medicine dermatology diagnosis, we're going to do 2 sessions because there's a lot of contents. Now we look at this one. This is the pathogenesis. As I said, it's very basic. We have all learned. I'll go through pathogenesis for each skin condition later. We're not going to talk about this today. Now let's go to the inspection. When a patient walks in, you normally straight away start to look at this person, which is the inspection has already started. Most patients have not much body changes. Some can have limited movement, weight loss, overweight, and miserable faces. Then we'll go to inspect the body part, patient will show you where the skin lesions locate. And then we'll go to the skin lesion. We'll look at the shape, the size, the texture, any bleeding marks, the color, the secretion, and the distribution of the skin lesion. The very common and the first skin lesion we're going to talk about is macule. In Chinese, we say ban. Very commonly, patients have red macules. It's the most commonly seen macule. Red means there's a heat. The red disappears when you press. It means the heat is in the qi level. If it doesn't disappear, it is blood heat. And when I just start to practice, I only remember this in my head. But one day when there was a psoriasis patient walking and showed me her really red skin, and then I pressed, the redness didn't disappear, which really approved. So it tells it's the blood heat. So the color of the skin really has some meaning for us and also help us to identify the pathogen for the skin condition. Okay, now let's go on. Light red indicates the heat is not severe. Deep red indicates there's a severe heat. The bright red showed heat has just started. The dark red shows the heat has been there for a while. The purple red tells us there's a deep heat plus blood stasis. The brown red tells us the heat is fading. Now, small amount of red macules tell us the heat is light. The heat is not so severe. Many macules on a large area tell us the heat is really severe. If there's more red macule coming up, it tells us the heat is still developing. If red macules are widespread to the whole body, it tells us heat has gone into both qi and the blood red level. It is quite severe. Now look at the scratches. Very often the skin lesion don't only have lesions don't only have one appearance. It sometimes have scratches, sometimes have scales. So next one we look at the scratches. If there's bloody exudate, there's blood heat. If there's watery secretion coming out from the macule, it tells us the skin lesion caused by damp heat. If there's watery and bloody exudate coming up, it is blood heat plus dampness. When there's itchiness together with the macule, it is showed there's a wind heat. If there's burning heat, it is excessive heat. Cold and purple macule is due to cold retained in the blood. Yellow macule is rarely seen. It is often seen on faces. Blue macule is often seen on Asian babies' buttock area. It is due to liver and kidney qi not yet sufficient. White macule with clear edge and a smooth surface is due to qi and blood disharmony. White or grayish macule with unclear edge mixed with normal skin fine scale and spread as patches, it is due to wind. Black macule tell us there's a kidney insufficiency. Kidney fire is produced. Fire retains in small collaterals, caused a black macule. It happens on forehead, behind the ears, forearm, and umbilical area. Brown macule, it's often on the face, forehead, and cheeks. It is produced by cheese scanation. Macules changes with mood. When people have stronger anger, and then these brown macules can be deeper in color. It can also caused by liver and spleen disharmony. This kind of a condition, the patient also have bloating, loose stool, distending chest. It can cause by Chong and Ren disharmony as well. In this condition, the macule color changes before and after period. Purple macule very often caused by blood heat, spleen qi or yang deficiency, and blood stasis. Now, papules, in Chinese we call children. Papules are normally red or purplish red. It shows the heat or heat with blood stasis. If papules is solid and itchy, it shows wind heat. If it is flat and mainly purplish red color, it is due to blood heat plus blood stasis. Here said flat, it still is papule, still pop up a little bit above the skin. It's different from macules. If there's a blackhead, for example, on the face, it is due to stomach and lung heat. If there's a vesicule on the top, it is due to damp heat. After scratching, if there's bloody exudate, it is blood heat. If there's watery exudate, it is damp heat. If there's pus, it is due to toxic heat. 3. Vesicles and blisters. Vesicles and blisters are normally due to dampness. If they appear many together with clear water and have not much red area around them, the dampness should be the main cause. If there's red skin around them, they are caused by damp heat. If the exudate is sticky, the damp heat is more dominant. If this itchiness and the lesion travels around with only little liquid in the vesicles, it is due to wind damp. If they have clear liquid with cold skin, and it shows the damp cold. Bully or blister with loose wall, clear and thin liquid inside, indicate spleen deficiency with accumulated dampness. Now, pustules. Pustules often show this internal heat. Internal heat accumulated inside the body can produce toxic heat. Toxic heat purify flesh, produce pus and stays in skin. If pustule emerge as group with light yellow pus and dry itself later, it is more likely due to damp heat, including toxic heat. If the pus is very small, mixes with blood, the appearance is a pinkish pus. Sit on the top of erythema and dry later to form pus blood crust. It is due to heat accumulated in the in blood level. External factors can also cause pustules. It is due to external toxin, invade skin, produce pus. The external heat toxin produce pustules with erythema, where pus goes can bring new pustules like impetigo. Damp toxin from external can produce vesicles, later produce pustules. If pustule rupture, it will have a thin pus come out. It takes a long time to heal. Now let's look at the wheal. Wheal can be red or pink. If it is exacerbated by heat, it is due to wind heat. If it is pinky white or white and exacerbated by cold, it is due to wind cold. If wheal appears bright red and raises as a long rash when scratching, it is blood heat. Dull red wheals appearing in area under constant pressure are due to blood stasis, like under our belt. Light red wheal with digestive symptoms. It is often caused by stomach, intestine problem. Pale or flesh color wheal linger for more months and years, exacerbated by overwork or tiredness. It is due to qi and blood deficiency. Now, nodules. Nodules are caused by flame congealing, blood stasis, and construction of collaterals. Scales. That's another very commonly seen skin condition. Scales are mostly due to wind, changes to dryness. Skin is malnourished. Fine brine-like scales are caused by exterior wind. Thin oily scales are due to wind damp. Oily and yellow scales is due to dampness. Dry, white or gray layered scales with red skin underneath, it is due to blood heat producing wind, then wind turns to dryness. Small amount dry scales in gray or silver white color and with pink or white skin underneath, it is likely due to blood deficiency producing wind. Now, crust. Purulent crust is due to heat toxin. Bloody crust is due to blood heat. Orange, yellowish crust is due to damp heat. Exudate. Clear and thin exudate relate to dampness. Thick exudate often relate to damp heat. Contagious exudate is due to damp toxin. Erosion, in Chinese called 糜烂, is red moist with light yellow and clear exudate, and contagious. It is caused by damp toxin. They're off my head. It's in front of the text. Pale or slight yellow moist with clear exudate is related to dampness. Pale or dark red with little exudate and long-lasting is due to undamaged and dampness retention. Now, ulcer. Pale and white ulcer is due to qi and blood deficiency. Dark red with exudate is caused by damp toxin. Dark purple at the edge of the ulcer is due to blood stasis. Pale and cold ulcer is due to yang deficiency. Now, lichenification. Light in color, it's related to the blood deficiency. Dark red lichenification is due to qi and blood stasis. Dark red lichenification is very commonly seen in eczema. Eczema is very commonly seen skin conditions. At the chronic stage, we often see at the patient's elbow or back of knee, the dark red lichenification. The skin is thick and hard with a lot of lines on it. So I think I don't have to explain more. Also, lichenification in light color can be seen in the chronic eczema patient elbow or other parts of the body, because after a long time, eczema is damaged in damaged blood, produce blood state deficiency. It relates to the light skin lichenification. So when we treat them, often we should consider tonify the blood a little bit. Okay, fissure. In the daily language, people call it cracks, but some fissure can be quite big. Cracks probably more small. Anyway, bleeding cracks, fissure with bleeding, it's often related to the blood heat with wind and dryness. Watery exudate, it's related to the undamaged and the dampness retention. If fissures with itchiness, it's often have toxin invaded. For example, fungus. Fungus is considered a toxin. If the fissure is really dry, it indicates qi and the blood malnourished. Scratch marks. Many scratch marks show this strong itchiness. So scratch mark is very commonly seen as well. It tells us this itchiness. Itchiness we talked before. It's related to the wind. With bloody crust, it tells us the blood heat generated wind. This existed. With the white liner scratch mark, it tells us wind or internal dryness. If the normal skin color scratch, but bleeding follows the scratch, it tells us this blood deficiency generated wind. We also need to inspect lesion shape. Some lesions have special shapes. We stopped here. Next time we'll continue to finish the inspection and the diagnosis. When we go through this, students maybe feel it's a bit boring, but this all very helpful, this content in our practice. they are very, very helpful, and they summarized by many, many practitioners, like put into the textbook. So I think you should save the content and when read them when you have time to remember them. When you see the patient, it will automatically come into your mind, help you with your diagnosis. We stop here this time. I'll see you next time. Thank you. Bye.